Beth Stevenson worried about breast cancer. A practicing gynecologist, she knows the disease strikes 1 of every 8 women in this country and claims 39,000 lives each year. She had heard about a new one-time test, Brevigen, that helps predict cases of sporadic hormone-dependent breast cancer, the most common and treatable kind.
And there's a new test available that helps you find out your risk for developing breast cancer. I'm joined now by Dr. John Shook from St. Luke's. Now, Dr. Shook, this test does not diagnose breast cancer, but it helps men and women understand their risk. Explain that.
Well, this is a predictive tool which helps the healthcare provider and also the woman to understand their risk for the development of breast cancer. There's no question that the way to save lives with breast cancer is early detection and preventive techniques. So if we can identify some of these women that are at higher risk, we can improve their management, their monitoring, and their surveillance. So yes, if we find early stage disease, their survival is incredibly better.
Dr. Schilling, when it comes to breast cancer risk management, if you had one thing to say to our viewers, our ladies out there, what would that be?
Every woman needs to know what their real risk for breast cancer is. So I would encourage women to go someplace where they have great expertise in breast cancer, find out what your level of risk is, get some counseling to see whether there's any ways that you can modify your lifestyle to reduce that risk, and then get on a surveillance plan. Currently, we recommend annual mammography for patients 40 years of age and older to help us find as many breast cancers as we can as early as possible.
I think that everyone needs to take this test. This Brevigen risk assessment tool is the best tool that we have to find out who is at risk for breast cancer. And we can make a dent in that number of 86,000 women a year that we can prevent breast cancer, because we don't want that to be you or your sister or your daughter or your mother or your best friend.
Women already know they should do self-exams and have regular mammograms to screen for breast cancer, but some are using another method to detect their risk before breast cancer develops. Couple First Molly Shen joins me to explain. Molly.
Mary, this is a DNA test that tells women if they have an increased risk to develop breast cancer. A handful of doctors in our area now offer it.
It's almost like taking a peekaboo into your system and trying to see where your pathway may lead. Try to treat that before you have that disease show up. This gives me information that can definitely prevent them from having illness, and quality of life is imperative.
Well, the key to successfully treating any potentially deadly disease is to start treating it as quickly as possible, and that means early detection. The new breast cancer screening test, devised here in Australia but trialled in the US.
It's time for me to get my results, and I admit I'm a little nervous.
And before I give anyone results, I always like to make sure you understand exactly what these results mean. Brevigen, as you may recall, is not a diagnostic test. So it doesn't mean you have cancer or don't have cancer based on this test. It's a risk assessment tool.
So it enables me to know what may lie ahead.
Correct.
And where I sit.
Exactly.
Right,
It'll tell you what your risk is over the next 5 years and over your lifetime to develop a breast cancer. So now I'll go ahead and show you your results. And you look here. And this tells us that based on just your risk on your family history and your hormonal profile, you have a risk of about 13% of developing a breast cancer in your lifetime. And when we look at your genetics, that increases your risk up to 23.9%.
23.9. And so am I average, above average?
You're above average. If the average woman is going to be a little lower than that, it's going to be maybe 10 to 12%, if that. You're about 1 in 4. So that means we're going to watch you more closely, work on lifestyle modification, exercise, diet, and again, do increased surveillance with clinical breast exams, mammograms, and we'll work on seeing if we can get some MRIs more frequently on you as well.
Well, now that I have annual tasks to do for my health, that's better for me. I feel more empowered. At least now I know where I'm at.
Absolutely, and that's the key.
Because I wouldn't have never thought that.
And that's what's so wonderful about this test, because it really does empower you.
Well, now I'm a step ahead of it.
Absolutely.
I'm not going to sit there and just wait for a lump to turn up.
Exactly.
I may be heading home with a bit more baggage, but it's a souvenir that may save my life.
Sometimes we don't always get the news we want to hear, but it doesn't mean we shouldn't listen. I have, and now it's up to me to stay sharp for myself and my family.